Hello, this is Dr. Do again. This video is still on alphabetic list problems on letter S. Today I'm going to talk about the common encountered procedure or protocol, which is the sport clearance for children or for adults. For children, I'm really referring to those younger than 12 years old. So there's this is, I think, it's for children, the major concerns are the congenital heart disease, or family history of other diseases like coagulation problem or sickle cells. So this is the purpose for the or seizure, for example, for the children. Some of the sports has to be cleared. And for adult, on top of those congenital heart disease, in addition to that, or inherited blood coagulation problems, or the other most important concerns is the cardiac capability. So these are the both for both age need to be cleared. So what are the first priority of this video is to bring out the emergency situation associated with the sports. Even though you're cleared on the join the team and you play sports, of course, acute injury. Regardless, you think probably it's just a small bump or fall, not necessary to seek medical attention. But my advice, my opinion is, regardless, small or big, if it's an injury during the sports, I think it's better to get clear up or to get examined by a physician to make sure there's no hidden serious problem. So that's the purpose. And so let's talk about what are the conditions really the physician are looking for to get you cleared or not cleared for the sports. For of course, the sports has different type, either dynamic, static, or swimming in the water, or just contact or non-contact. Those are all in the considerations. For the children, I think if you have family history of hemophilia, for example, coagulation problem, or has a history of splenomegaly, which means enlarged spleen, those are really, I think, the contact sports with which has a great risk of hemorrhage or a blunt injury to the internal organs. For example, spleen, like I think I mentioned before, it's a very fragile organ. So if that's the case, it has to be cleared by your physician. And also some sickle cell disease, for example, severe sickle cell disease cannot participate in certain of sports. And also congenital heart disease, heart valve disease, or family history had sudden death or premature sudden death. So for example, the Marfan syndrome is also cannot cleared by the physician. And also recent trauma, of course, that's on top of it. So these are the clearance for the children. And also on top of that, the vision exam, make sure you can see clearly, and also along with the physical exam, whether there's a murmur or no murmur. So this is about the children. For the adult, regardless whether you were athletes when you were young, I think that's probably is a past. But right now, for the adult, I think the physician need to clear. You do not have uncontrolled high blood pressure. You do not have the new onset murmur or the arrhythmia, or you do not have the long-term undernutrition or malnutrition. For the children, for young adult, the uncorrected malnutrition, for example, the anorexia problem, or binge or bulimia. So those, if that's not diagnosed or not corrected, I think certain sports can be really need to be prevented. You cannot participate because the theory behind this is the malnutrition caused the iron disturbance, the potassium particularly, and the calcium or sodium caused the arrhythmia, sudden asystole or some other problem. So for adult, the heart irregular beats I mentioned, of history of hypertension, history of coronary artery disease, or on top of the genetic disease, either blood coagulation or valve disease. Those are the what the physician looking for. So of course, through the test, or if you're on the blood thinner, certain of the sports, contact sports, probably also is on the consideration. You may or may not participate based on your physician's advice. And on top of that, of course, chronic other diseases, either diabetes or the kidney disease or liver disease, caused splenomegaly, and also history of genetic diseases. So these are all for adult and need to be cleared. So on top of that, I think for my opinion, for adult, for those who had those kind of chronic diseases, I think the best sport is walk, at least 30 minutes, at least 5 days a week. That will serve the sustaining force, the continuity. You do every day, you do regularly, is your body to adjust to this gradually increase the time or distance. So that's really particularly for those had heart problems. So this is I think one of the optimal exercise for older people, particularly for those older people with comorbidities. And of course, there's a special group of people with back pain, obesity and back pain. The exercise, they desire to exercise, but each time the exercise causing them pain. That's really, I think it's a concern. For those people, I think a water exercise probably is one of the best choice, because the water give you the floating force, mechanically decrease the burden to the back, to the spine, and limited the pain, and also you do it regularly and can help you to lose weight, and also lose weight at the same time will decrease the pain. Of course, if you do not like water exercise, you want to do exercise, talk to your physician, get some pain medication to manage your pain, to affiliate with your desire of exercise to lose weight, and at the same time cut the calorie. So this is about for those special group people, could be young, could be old, could be middle-aged, a lot of people with overweight, but the back pain really bother them. So stop them from exercise. So if that's the case, talk to your physician first, and then to even though it's not you do not participate in the team, you just want to walk, exercise individually by yourself, but the pain if stopped you from exercise, talk to your physician, and your physician will clear your other problems like heart or blood pressure or diabetes, and then give you pain medication to ease the pain and to affiliate with your exercise to reach your goal. So this is about sports clearance, because it's so important. Everybody, we talk the health, lifestyle, exercise. I think so. This is just probably you already know, probably you have had it before, but just to remind you, if you want to participate in any sports, talk to your physician, particularly for older people with systemic diseases. So I'm going to stop here, and I hope it helps, and thank you for watching. I will see you next time.